This morning, medical professionals and lawmakers came together to advocate for more funding for women's health research. They were joined by two award-winning actresses, Lupita Nyong'o and Mandy Moore. I had a chance to speak exclusively to the women about why they're taking their fight for research all the way to Capitol Hill. On Capitol Hill today, a plea for bipartisan support.
We are here today because women's health has been overlooked for too long.
As advocates and medical experts alike push lawmakers to address what they say is a chronic underfunding of women's health research.
This disease costs $250 billion a year right now to the United States government in Medicare and Medicaid.
Women's vitamin company Parallel teamed up with the nonprofit Society for Women's Health Research.
I really am honored to be here with you.
Along with actresses Mandy Moore and Lupita Nyong'o.
We represent all the women who are confused, frustrated, and desperate for solutions that favor their well-being.
They're urging lawmakers to prioritize women's health in federal research funding ahead of the appropriations deadline on September 30th.
For years, I felt like my voice and my experience didn't matter, specifically in my own fertility journey. After years of trying, I was told that something must be wrong with me.
The disease starts 20 years before first symptoms.
ABC News was invited exclusively to the closed-door roundtable discussion. Even before she had children of her own, singer-songwriter and award-winning actress Mandy Moore played a mother on screen in the hit family drama This Is Us.
When Dad died, it was a shock.
Now a mother of three, Moore has become a maternal health advocate and paid spokesperson for Parallel, striving to destigmatize discussions about women's health and close the gender research gap, pointing to the vastly underrepresented clinical research on the topic. She was joined by actress Lupita Nyong'o.
500 pounds of cotton, day in, day out, more than any man here.
Who's known for her roles in films like her Oscar-winning performance in 12 Years a Slave. Nyong'o went public with her own health struggles earlier this year, announcing her struggle with uterine fibroids on Instagram. I debated about whether or not to share this publicly, something I also shared as part of my own journey last month. For years, I've been plagued by fibroids. And until recently, I rarely talked about them, even as they silently shaped parts of my life.
Good.
Today, Nyong'o is urging lawmakers to emphasize uterine fibroids research as a critical part of women's health funding. Thank you both so much for having this very important conversation. We really appreciate it. Of course, you just spoke with lawmakers on Capitol Hill, talking about what you all have described as a chronic underfunding of women's health. What do you think would be the best possible outcome from that conversation?
Well, the allocation of funds into women's health. So far, it's been only 8% of the budget, and that is just way too little considering that we're 51% of the population. So we need a whole lot more money put into funding so that we can get to understand women's bodies better and bring us to healing sooner, faster, more effectively.
And I think it's such a critical time right now because we're going into the 2026 budget negotiations. So now is the most appropriate time and most critical time to be having this conversation with members on both sides of the aisle.
Did you feel like there was a promising reaction?
Yeah, it felt like there was a lot of good faith people that were all sort of collectively working towards this. I mean, as Lupita said, we are 51% of the population, and for far too long, I think women's health just in general has been such an afterthought. I mean, we both have our own stories to tell. I think all women have their own individual story, but mine specifically revolves around infertility and being diagnosed with endometriosis, which then I didn't end up having, and all of these complications. And it's not so much that I think doctors are all well-intended, but the fact that we don't have the language, we don't have the research, the breadth of research that's really needed to have these conversations to be able to answer women's questions. There's so much confusion and frustration when we're not able to get the answers. And all of this funding, all of this collective conversation is to really affect change.
What made it for each of you a point where you said, not only do I need to speak out about this, but I need to go to the highest heights, to Capitol Hill, to talk to people who can actually orchestrate change?
Well, I was first diagnosed with fibroids 11 years ago, and at the time, I was given two options, either live with the pain and discomfort or have invasive surgery. I ended up doing the surgery, but when I asked my doctor what I could do to make sure that they didn't come back, she said, there's nothing you can do. It's only a matter of time until they come again, they grow again. And I was so stunned by how little my doctor could tell me about this condition, and I felt so helpless. And I'm not a scientist, so there was no way for me to really feel like I could do something about it myself. So I would say that I have felt alone. I felt very isolated in my condition, and that was why I wanted to speak out about it, but also why I wanted to support other women who have the scientific background, who have the policy platform.
And Mandy, were you told at one point you're not going to be able to have children?
Yeah. Yeah,
now mother of three.
Yeah, now mother of three. I was told that I had endometriosis and I had something wrong with my uterus that would require surgery. And until I had that surgery, it wouldn't be possible for me to get pregnant. And luckily, I have the privilege of going to another doctor, and I got a second opinion, and that second opinion confirmed that, in fact, I don't have endometriosis and my uterus was fine. And I was very fortunate to go on and have 3 healthy pregnancies. But the fact that, like, my doctor didn't have the language to really explain to me what was wrong. It was just sort of like, there's something wrong with you, there's a problem to be fixed, and there wasn't much discussion, there wasn't much compassion beyond, like, surgery is going to be the only solution that fixes you.
You've mentioned before the 4th trimester of pregnancy. Explain what that is, and also how Congress could be an advocate.
Just thinking about everyone's postpartum journey, we're all products of someone birthed us, right? So, like, we all should be able to take part in this conversation. But I think so often women feel alone during their 4th trimester in their postpartum journey. And I feel like that should definitely be a part of the conversation when it comes to us all championing women's health and funding women's health initiatives.
How do you think that Congress could help?
I think it's all about appropriating funds. Like I said, we're sort of at this really critical juncture with everyone talking about the 2026 budgets, and they're going into negotiations, I think, in the next 2 weeks. So now feels like the right time to be having this conversation and really calling on folks out there, other women, to share their stories, talk to their members of Congress.
You mentioned that it was 11 years ago that you had the myomectomy, the surgery to get rid of and remove the fibroids. What was also happening 11 years ago in 2014, as you're celebrating what many would assume was the highest point of your career at that time?
Yeah, that was the year that I won an Academy Award for my very first film, and it was a time of great jubilation, and then this overshadowed it, and I had to deal with my health in a very real way, and that was what was going on in private, and it was quite confusing to be having such a high and such a low at the same time. But that is the thing about fibroids, is that they're invisible.
There is a report that from 2013 to 2023, only 8.8% of NIH funding went toward women's health research. Why do you assume that is?
Because there's not enough women in the room.
Not enough women at the table, yeah.
Yeah, I mean, I think at the end of the day, we're human beings, and the reason why we're able to speak about these things is because we've been personally affected by them. So when it comes to women's health, I think that in a room full of men, it's easy for it to be not first on the agenda. So I think it's very important that there are more women in the room in order to insist on our needs to be met. But also to call on men who have relationships with women and make them aware. And we had men in the room today, so it's not a lost cause. That's why I have hope, because I think sometimes it's not that you don't care, it's just that you didn't know. So that's why we have to talk about it. And something like fibroids is something that a lot of the women live with shame, because we're not in a world that conditions us to talk about it. You know, women's pain, I think we're conditioned to expect to be in pain and to handle it gracefully, with dignity. It's not talking about
minimize
it. Yeah, minimize it.
Apologize for it.
But I think when we start to be honest about it and to hold it in the light, share it, that's what's going to bring about the change and bring it to the foreground, to the consciousness of men and women alike.
The other interesting number, and there are a lot of stats out there, but that men typically experience erectile dysfunction, about 18% of men, where nearly 90% of women often experience PMS. And yet, if we look at the year 2015, there were 5 times more scientific studies on erectile dysfunction than PMS.
Yes.
Is that kind of discussion being brought up to the men in the room?
All of the statistics are being thrown out there, for sure.
Yes. One of the ways in which I'm hoping to contribute to the improvement of research or the availability of research for fibroids is by partnering with the Foundation for Women's Health. We have a Lupita Nyong'o uterine fibroid research grant that we have launched. So we will hopefully be participating in finding more non-invasive ways to deal with uterine fibroids.
We are launching an initiative to fund women's health. You can find it on my socials, on Lupita's socials, on Parallel Health's socials. And basically, we're just encouraging women to share their stories, to write their member of Congress, and feel like they have the permission to share what their lived experience is.
There'll be a template, you fill it, you send it, make your voice heard.
Yeah.